I'm curious about the atmosphere in Washington right now. You've been there since 2009, but you've been connected in one way or another to that world for decades now. How is Washington and our government different under President Donald Trump?
I think there's a lot of uncertainty. That's the word that I would use. There's uncertainty about the budget situation. There's uncertainty about international affairs and what our policies are. There's uncertainty about domestic policies, about health care. And I hear that, as I said, as I travel around New Hampshire. People are not sure what the policies of this administration are in so many areas.
One of those big areas that the president made a lot of promises on the campaign trail was obviously opioids. We now know for sure what we're getting out of the 21st Century Cures Act. That had been something you wanted to work on to try and increase. Do we know exactly what happened? I know obviously the Obama administration pegged it to population rather than percentage of need. Why did that formula get stuck in there, and how come we couldn't change it?
You know, it's very frustrating to me as somebody who worked really hard on that. And Congress put in language that said the funds should be targeted to those states that are in greatest need. And unfortunately, what the Obama administration did was to take a formula that was pegged more to population than it was to need. And because and I had several conversations with members of the administration, with former director of the office, the former drug czar, Michael Botticelli, about this, where he said, well, our goal was to try and help as many people as we can. Which I appreciate. We all want to do that. But the challenge is in New Hampshire and in states that have been hardest hit, we have a significant impact because of the percentage of overdose deaths here, because of the number of people who are affected. And that is a harder thing for a small state like New Hampshire, for some of the other states that have been hard hit, to address.
The work continues, obviously. You've recently filed legislation that would focus prevention dollars on student athletes. This issue where, you know, I think I've interviewed a young man from Milford who said he had a sports injury at age 12 and was prescribed opioids. This is going to try and stop that part of the problem early, I'm guessing.
Well, the goal is to try and prevent. Prevention is always better than treatment and what's required for that. And so if we can prevent it, it's really important. And some studies show that student athletes are more than a third likely to have used opioids and to have some other form of substance use disorder. So if we can make people aware of that, coaches and teachers and teams, then hopefully we can prevent that from happening. And, you know, one of the things that I've learned about this devastating epidemic that we're experiencing is that we've got to focus on every angle that we can. We've got to work together. We've got to look at everything that might work. And so this is an effort to look at something else that might work.
We see that the efforts to repeal and replace Obamacare seem to be gaining some new life in the Congress. What's the perspective from the Senate here? And particularly, what have you heard from your Republican colleagues, whether or not they're seeing something take form that they might be able to support?
Well, this latest plan, I haven't seen it. I don't think anybody's seen it, really. And so I haven't had a chance to talk to my Republican colleagues. But I can tell you from the last debate that we had Republicans in the Senate who said we're not going to support anything that's going to dramatically affect the number of people who can get health care or is going to reduce the quality of that care that people can get. And so I think that's the challenge. You know, one of the biggest impacts in New Hampshire is that for those people who are getting treatment for substance use disorders, almost all of that treatment is coming through the expansion of the Medicaid program, the New Hampshire Health Protection Plan, which was a bipartisan plan done by Maggie Hassan when she was governor and the Republican legislature. It's been working. And if that gets changed, if the Affordable Care Act gets repealed, all of those people who are getting treatment are going to lose that treatment, and there is nowhere else for people to go. So this is a life or death issue for so many people, and what we don't want is a plan that's going to kick people off their health insurance. It's going to increase costs for people, give them less coverage for their health care. It's going to increase costs for elderly Americans, and is going to do it all to provide a tax break to some of the wealthiest people in this country on their health care. I mean, that's not a plan that makes sense, and that's the Republican plan that we've seen to date.
It's interesting to see that the issue of health care is so difficult to grasp for whichever party is in power. It's almost like you try and touch this thing and it electrocutes politically whoever's going to try and grab it. Speaking of the pure politics side of things, we're seeing this tremendous increase in activism around opposition to President Trump. If you don't mind putting on your political activist hat from back in the 1980s, you were there at the Women's March in Concord. What's the best way for Democrats to harness what's going on now and channel it into 2018?
You know, I get asked this question probably more than any other about what can I do? What can I do to make a difference? And my answer is, you know, get engaged in the political process. You know, contact not just the federal delegation. We're all Democrats, so we probably share many views on most issues. Contact members of the state legislature, contact the governor's office, contact those organizations that agree with your views on things and support them regardless of whether it's Move On or whether it's the Sierra Club or, you know, whether it's Planned Parenthood. Get engaged, talk to your social networks and ask people to stand up for what you believe in. And I think that's true of everybody in this country. You know, that's what makes democracy work. And when people stop paying attention, when they don't realize that elections have consequences, that's when things change. And so people need to stay engaged.
That Democratic excitement seemingly very similar to what was going on in 2006 around opposition to the Iraq War. We're already starting to see candidates show up, and we know that one perhaps candidate, likely not, but former Vice President Joe Biden will be here. We had some video we wanted to show you here that he's been coming to the state for a long time, and you can see right here this is from a fundraiser at Yokin's, I think, back in 1987. There's you and Mr. Shaheen and Vice President, or excuse me, Senator Biden back there. And you remember what you were talking about there? Was it kind of like, hey, so someday you're going to be Vice President, someday I'm going to be a senator, or what?
I have no idea, but he would probably say he had more hair in those days.
What does he mean? I mean, he's going to be at the McIntyre-Shaheen dinner. What does Vice President Biden mean to Democrats in New Hampshire?
You know, Joe Biden is the epitome of a great public servant. He's somebody who's been in politics for the right reasons, who has worked hard all of his life to try and make a difference for people, who has tried to work across the aisle with his colleagues when he was in the Senate. He was one of the people, he was the person who came in and negotiated with Mitch McConnell when we were on the edge of disaster around a budget deal and was able to get something done. And he's going to continue that because he's doing what he really believes in and what he thinks is going to make a difference to move this country forward and make a difference for everybody in terms of opportunity and the kind of life that they lead here.
Do you think someone like him should be looking at a run for president, or is it time for newer, fresher faces there for Democrats?
I think it's way too early to be looking for 2020. I hope that what we can do here for a little while is to think about how we might be able to work together to address some of the challenges this country faces. I'm very concerned about the lack of civil discourse, about the polarization in the country, about the unwillingness to work together. And we need to get beyond that. And Joe Biden's the kind of person who can help bridge those gaps.
All right. Senator Jeanne Shaheen, thank you so much for joining us on this Sunday.
Nice to be here.
We appreciate it.